Okay, for this video, we're going to do the top 50 books of all time. We're just going to do the last 6 books. So from book number 45 to number 50. Main topic here today is going to be cancer. So the first book is called Tripping Over the Truth by Travis Christofferson. I thought this was sort of a groundbreaking, great book because what it did is it put the idea of the metabolic theory of cancer into the public consciousness. Everything in conventional cancer therapy is based on what's called the somatic mutation theory, the SMT. But the metabolic theory of cancer, the MTC, metabolic theory of cancer, MTC, it's a much better theory. It makes much more sense. And some of the strong points of this book, Travis Christofferson is the author of it. And this guy, he's like a guy who has like a master's degree or something in biology or science. And he's just a smart guy and he's a very good writer. Okay, but he's not some like research professional or advanced degree person. But I'll tell you something, he did a great job with this book. It's very clearly written. And when you're done reading it, you totally get it. Basically, what he said is that the somatic mutation theory that all of medicine goes by is wrong. He said the Genome Atlas Project showed that they couldn't find a consistent pattern of mutations, like a stepwise set of mutations that would indicate the causation of a cancer. And if you look at cancer, cancer is not one little mutation. Cancer is an entire change in its way of life of an individual cell. It basically goes from being part of a cooperative cell within a multicellular organism, like a liver cell does what liver cells do. They make bile, they detoxify chemicals in the blood, they manage blood glucose levels. That's what a liver cell does. But a cancer cell in the liver says, screw this, I don't have enough energy to function as a liver cell. I'm just going to replicate myself like a bacteria. Take this job and shove it. So what in a sense the cancer cell is doing, it's reverting to a primitive form of metabolism, like becoming like an anaerobic bacteria. And so the question is, well, where did the idea for the metabolic theory of cancer come from? And it comes from Otto Warburg. This is a quote by Otto Warburg. It's in his book, though. That's why they got Travis Christofferson's name here. Cancer, above all other diseases, has countless secondary causes. But even for cancer, there is only one prime cause. Big statement. There is only one prime cause of cancer. Summarized in a few words, the prime cause of cancer is the replacement of the respiration of oxygen in normal body cells, so aerobic metabolism and mitochondria, replaced by a fermentation of sugar. Fermentation of sugar means anaerobic metabolism of sugar. So Otto Warburg, what he basically said is, if you injure a cell by hypoxia, dropping the oxygen delivery by about 35% or more, many cells will die, but some will transform into a primitive form of metabolism, going on anaerobic glycolysis, and they'll survive, and they'll revert to behaving like a anaerobic bacteria, meaning that they simply want to replicate. They no longer function as part of a multicellular organism doing the job of a liver cell, a kidney cell, a pancreas cell. And so basically all it takes is hypoxia. Well, it's very easy to get hypoxia. We got tons of hypoxia all over the place in the Western world. All the high-fat diets, the hypertension, the diabetes causing atherosclerosis, inducing hypoxia, thickening capillary basement membranes, and vascular smooth muscle. So you have a clear mechanism. Plus you have all this inflammation, chronic inflammation from gastroesophageal reflux, chronic inflammation in the liver from hepatitis, creating scar tissue, like from inhaled asbestos in the lungs, creating scar tissue. That scar tissue entraps some normal cells. Those cells are hypoxic because they now have increased distance from the capillaries that deliver oxygen, and they can transform into cancer. Okay, so it's a fantastic book. Now, just a little follow-up on Travis Christofferson. He started hanging around talking to that Thomas Seyfried guy. And Thomas Seyfried did some great research, brilliant research on the metabolic theory of cancer. But he doesn't know much about nutrition, and they ended up in that keto for cancer, which is absolutely stupid. Okay, if you study cancer metabolism, you'll laugh at keto for cancer. It's completely stupid. Okay, next lady I want to show you about is Kelly Turner. And Kelly Turner wrote this book first called Radical Remission. She later wrote a sequel to it, the second edition in a sense, called Radical Hope. The gist of it was she was working as like a clerk. She now has a PhD at Sloan Memorial Cancer Center, and she had a cancer patient who had survived metastatic cancer, and she's like, wow, is this fantastic? She's talking to the patient, what did you do? What seemed to help? And she interviewed the patient, and then she went and spoke to some of the other workers there, like the doctors. And she's like, this patient survived metastatic cancer. Isn't this fantastic? Listen to what they did. And they were like, so what? It's just anecdotal. That has no significance compared to like a big clinical trial with 400 patients or something. And she's like, well, I think we ought to at least talk to him. Somebody survived metastatic cancer for decades. Shouldn't we at least find out if we can learn anything from him? But no one else was interested. And she saw that as being bizarre, and she had another similar experience. So she decided on her own to study these long-term survivors of metastatic cancer. Because usually metastatic cancer patients, they just tell them, make a will, you're dead in a couple months. All right. And so she started studying these metastatic cancer patients. And what she found was there were a lot of them, and a lot of them had done very similar things. So 9 steps right here, key steps to radical remission. Number 1, they would sort of take charge of their own care. They would listen to their doctors, but they wouldn't necessarily do what the doctor said if they didn't agree with it. They would be very interested in the details of their care. For example, somebody has a prostate cancer. One guy would check his PSA, change his behavior, repeat his PSA like 4 weeks later, 6 weeks later. And if his PSA was coming down, he'd keep doing what he's doing. If his PSA wasn't coming down, he would change what he's doing. And he was able to keep his PSA down. His prostate-specific antigen, it's a blood indicator of prostate cancer. So anyways, she saw that they switched to eating a plant-based diet. She saw that they liked to exercise and walk, okay? That they maintain their social support. Things like that. She has a course for cancer patients that they can take too. So that's Radical Remission by Kelly Turner. She did more than that. She traveled all around, and she would drive to their houses and interview them. She called them on the phone or did whatever interviews she could. So she ended up interviewing a whole bunch of them. I don't remember the exact number. I think it was like around 1,000 of them. So I think she did a great job. And that she did exactly what a person should do. The conventional medical system never gives a rat's ass about individual patients because there's no money in that. And a doctor does not need to have any loyalty to the patient. All that stuff about patient loyalty, that's not what it's about. The doctor's loyalty must be to the standard of care. So if a patient has cancer, there'll be some standard protocol for treatment of that cancer. If they follow that standard protocol, it doesn't matter if the patient dies tomorrow. They still get paid. They can't be sued. On the other hand, if they were to sit there talking about vegan diet, reduce the cancer chemotherapy dose, not go by the standard protocol, and then the patient dies 10 years later, the family could say, you didn't follow the standard of care. They could get sued. They would lose. So that's why, sad to say, but what matters is the standard of care. That's what you get paid for. That's what's expected of you. And if you don't provide that, you can get in trouble from the profession, your colleagues, or if you have the case in court. So the standard of care is the big thing. The patient's kind of irrelevant. Okay, you could just prescribe that for a robot, somebody somewhere else that you never met. I'm just trying to tell you because patients come there. Patients say things like, "Oh, that's my doctor. My doctor's so nice. My doctor's taking good care of me." And they don't really understand. A lot of times they're just, basically a number. This is the lung cancer patient. This is the pancreas cancer patient. And they're put into a slot that says standard protocol for stage 2 pancreas cancer is this. Standard protocol for stage 3 kidney cancer is this. And that's why the patient should be involved because also a doctor has to know a ton of stuff. I had to memorize, for example, books and books and books to pass my boards and all this stuff. What I'm saying is, the patient's disease is one little tiny part of that spectrum, such that if they read a lot about it, depends on the field, it depends on the context, they can learn it better than the doctor a lot of times. Don't get me wrong, you're not going to learn how to operate on the pancreas overnight. That takes many, many, many years of training. All right, but you could learn about all the details of your one specific type of cancer a lot of times better than doctors, better than the so-called experts, because you got the time to just read about that. If I was diagnosed with cancer, I would immediately take a whole bunch of time off from work and just read, and find out what actually helped in this particular cancer, if anything. But you'd be surprised a lot of times going for optimal care, optimal results yields a much better situation than just going with the standard. The standard is for, demented people, intoxicated people, low IQ chumps, lazy people, drug addicts, alcoholics, all that, versus a motivated, intelligent person that studies their own condition can often do much better than that. Okay, here's Ruth Heidrich, PhD. She's a lady who had metastatic breast cancer. She went to Dr. McDougall, became a vegan within 2 hours of talking to Dr. McDougall, and then she's alive over 40 years later. She was diagnosed with breast cancer in her 40s. She's now in her late 80s. So she initially ate the McDougall diet for many years. Then she switched to eating more of a raw vegan diet. She's won tons and tons of medals for marathons, triathlons, and stuff. You know, when she was in her 40s, they told her, "You got metastatic cancer. You should make a will. You know, you're probably going to die soon." She said, "No, I want to run a marathon," and she did, and she's been doing that. The other thing interesting about her is she got hit by a car when she was riding her bicycle, had a bad fracture of her lower leg. And they told her she'd never walk again. And, you know, she eats a lot of greens, and she believes that really helps her heal fast. She healed in a couple of months and was running again. So rather extraordinary healing. She had a comminuted fracture, meaning broken into multiple parts. Those often don't heal well in a weight-bearing bone. Okay, here is another lady. This lady's name is Janet Murray Wakelin. She is a lady who also had metastatic breast cancer. Here is her with her husband. This is her book, Raw, saying that it can, you know what, cure cancer. And she also has been alive over 20, I knew she was alive at least 22 years after her diagnosis with metastatic breast cancer. She also was told, make a will, you're dead soon, there's nothing you can do about it. She loved to run. She lives in a warm climate. Also, Ruth Heidrich, the last lady, lives in Hawaii, obviously a warm climate. She lived in Australia, another warm climate. This is a map of Australia on the shirt of her husband that's on her husband's chest. And she decided to prove how healthy she was to run a marathon every day for an entire year. You know, that's incredible. A regular person runs a marathon, they can't do anything for a couple of weeks. She ran a marathon, 365 marathons in 365 days, all around the perimeter of Australia. Okay, and her husband went with her too. He's a long distance runner guy too. To me, what that says to me is you got to have some wealth. Okay, you can take off an entire year and not have to work and just run around. I think she was doing a fundraiser, you know, and also, you know, her whole approach was go raw vegan. Okay, she had studied the results of the different treatments for her form of metastatic breast cancer, and she felt the results were not that good. So she said, I'll take my chances with the raw vegan diet and with exercise, and she did. It's a good book. She's not a health person, not a medical person, but she's a smart lady. I think you're going to see a pattern, though. You know, Ruth Heidrich is a very pretty lady. She had a husband supported her. She lived in a warm climate. In a warm climate, you're going to have more fruits available all year round. So I think that helps. If you got a husband paying your bills, you don't have to work every day. You can take more time off. A lot of places, jobs will have family medical leave acts where you can, you know, take 6 months or a year or something off and just get your act together. Here's another lady, and kind of similar to that pattern. She lived in California. She was actually kind of a famous surgeon. She was an orthopedic surgeon. This lady's a genius. She's kind of crazy. And I'm going to tell you something, too. I've studied genius. I spent a long time reading tons and tons of genius biographies and essays and books about genius and great achievement and all this stuff. And almost every single genius is kind of crazy, okay? She's a little bit crazy, but man, is she smart. And listen, I'll just tell you a few things she said. She said, look, she says, doctors don't know how to treat cancer. She says that she studied all these different doctors who had cancer, and they had average survivals. She said if they really knew what they were doing, they would have better than average survivals. How come even these big shot names at big name universities, they do no better than the people at regular places? She goes, they don't know how to cure cancer. And she says, why should I do what they do when they don't seem to know what they're doing? And then she also said that it has been her observation that all these chronic diseases are chronic because the drugs don't work. She said these drugs, they never cure these diseases. She said the only drug that cures anything is antibiotics. And don't get me wrong, that's obviously an overstatement. But I'm letting you know how she talks. I'm also making the point, look, she's a very pretty lady. She lived in a warm climate in California. She had a husband to support her, so she could buy whatever food she wanted. She didn't have to work at that point. She retired. She had been like a chief of surgery, of orthopedic surgery at, I think, UCSF Hospital before that, okay? She's a very outspoken lady, but she says a lot of things. Here's what she says. She says, the best treatment for most diseases is the same thing. It's God's way of healing. She said God's way of healing is to eat a low-fat vegan diet and to study the Bible every day, to pray. She says it's free because it's available to all people. You have to eat some food anyways. Get your sunshine, stay hydrated, you know, have loving, supporting relationships, help other people, all this psychological stuff. But she's very, very Christian. And don't get me wrong, like I said, if you read her, you'll be amazed, number one, at how smart she is. But number two, you'll be amazed kind of at what a hothead she is. She's a big hothead, and she has very strong opinions about things, some that will shock you. But, here's a pretty impressive title. Cancer Doesn't Scare Me Anymore. She was diagnosed with metastatic breast cancer, I think around 1997. And she eventually died in her late 80s. She just died about a year ago, something like that. But she inspired a lot of people. A lot of people who you'll hear about, like Chris Wark, the colon cancer guy who survived, I think, metastatic colon cancer. So what I'm saying is, if I had cancer, I would study all these people who survived, not all of them, but the ones you can, who had survived metastatic cancer for decades and decades, and see what you can learn from them. But that's what she did. She went 100% low-fat vegan, 100% vegan, and she's 100% religious. And anyways, she's rather fascinating. Okay, then what happened was I wanted to really understand cancer as well as it could be understood. So I wrote this book all about the molecular biology of cancer, the pathophysiology of it, the biochemistry of it, and all the things you could do. And I made videos about all the stuff. I made a checklist of what I would do if I had cancer, one-page checklist of everything a cancer patient can do, and how to understand cancer. Because once you understand cancer, what you'll realize is you might have had some mutational injury many years ago, hypoxic injury years ago. There's nothing you could do about what happened in the past. But there's a whole bunch of things you can do to create a more favorable milieu for your tumor. Optimize oxygenation of the tissues, alkalinize your blood, okay? And you do that by just eating a low-fat, low-sodium, plant-based diet, okay? Exercise, get your sleep, all of that stuff. Avoid all these different toxins, be religious. When you exercise, you get your lymphatics pumping and you move the white blood cells through your lymphatics so they can travel to the cancer and remove the cancer cells. You can increase lymphatic flow about 30-fold. You have an entire vascular system that runs parallel to your blood vessels. It's called your lymphatics that are not connected to your heart. And those are moved by exercising. So you want to exercise like crazy. Okay, that's why I think it's not a coincidence that Ruth Heidrich was running marathons. You don't have to run a marathon. That's a little bit crazy. But just get some significant exercise every day, okay? So anyways, these again were my two wrestling coaches, world and Olympic champions, Mark and Dave Schultz. All right, and then here's book number 50. I'm actually going to show something after this, but here's book number 50, an honorable mention book. Ischemic spine is the most common cause of back pain. And basically, there were some papers about ischemia, lack of blood flow, increasing the risk of degenerative disc disease in the spine. At the lumbar level, for example. But I figured out it's the entire spine, lumbar, thoracic, and cervical, and that it's not just degenerative disc disease, meaning drying out of the disc, cracking of the disc herniations. It's everything in the spine. It's all primarily related to ischemia. It can also be related to trauma. It can also be related to some chemicals, like fluoride can do it, F- in the water. And it can also be due to GP, glyphosate, glycine phosphate. Glyphosate, because they can, every third amino acid on collagen is a glycine, and the glycine phosphate, it appears that it can substitute for that, and then intercalate itself into the ligaments, into the collagen. 1/3 of our body's proteins are collagen, and then weaken those triple helix ligaments. F- can also weakens collagen. There's a bunch of papers on that. So anyways, I figured out that it's also the same thing causes disc, bridging osteophytes across the disc space, interbody fusions across the disc space, calcification of the posterior disc margin, and that progresses, and it's called OPLL, ossification of the posterior longitudinal ligament, calcification, ossification of ligamentum flavum, OLF, ossification of ligamentum flavum. It's called OLF, ossification of posterior longitudinal ligament, it's called OPLL. And then fusion of the spinous process out here, that's called Bostrup's disease. Okay, they're all the same thing. They all go together. And then you get stress shielding of the adjacent vertebra, becomes osteoporotic, and if they fall, they're very vulnerable to chalk stick fractures due to having a brittle fused spine. So anyways, I figured that all out, and I wrote a book about it. I was pissed off because I tried to publish a couple of papers, and the spine journals would not publish the paper. And I know why, because there's no money in it. Their paradigm is, if you operate on the back, you make money. If you inject steroids, you make money. You teach the patients to eat low-fat vegan and get adequate vitamin C. There's no money in that, so they won't publish it. And it's because it's a paradigm shift. If you answer a micro question, oh, that's wonderful, but you shift the paradigm, they get pissed off and they won't publish it. So that's kind of how I ended up writing books and ended up on the internet, because it bothers me that in conventional medicine, the more advanced and smarter you get, the more the more mad it gets at you and the more it refuses to publish you, the more it refuses to let you have a platform to speak to other doctors. They don't want doctors to know this, okay? All right, now here's just a couple other books that I wrote. I put these as honorable mentions. The funniest book I ever wrote was called A Tale of Two Tubs and a Hot Tub. It basically compares two patients, and they're both trying to impress a girl, and one of them, figures out how to improve his health. The other one just does all the conventional stuff and gets his foot amputated, all the stuff that typically happens to conventional patients. So that was my funniest book ever. Doctors would walk up to me and they would just laugh and they would tell me it's the funniest medical book they'd ever read in their lives. And I'm proud of that one. I might someday do a new edition on it because it was one of my favorite books. Hot Topics in Nutrition with Clinical Correlation. It was a good book. Journal of the Optimal Health was also, I think, one of my best written books. That book pissed off people too because I say and I write things that are just the truth and people don't like it. The truth is very offensive to people, especially in healthcare. They want to be fat, sick, and stupid and take their pills, and you tell them, look, here's what's really going on. They don't like that. How to reduce risk of cancer and chronic disease. This is almost like a big biochemistry text to some extent. Basically what was happening was there was the big infectious thing going on, a couple years ago, and everybody was kind of shut in and nobody knew what was going to happen, when it was going to end. So I kind of had this idea, I had like 6 books in my head I wanted to write, so I just cranked them out. And I wanted to get all this information, so I put tons of advanced information about neurodegenerative disorders into this book because I had to write it then or I would never write it. And I did. But the big new reason, why did I write all these new books, like the Medical Reformation and stuff? And that's probably my best medical book. Where is it? I got it around here somewhere. I did it because I learned how to draw. Before that, in all of these books, I didn't have a drawing program, so I couldn't draw. So I think the text is great in these books. I'm proud of it, but I wasn't able to draw. And the book is much better when you can draw pictures in it. So that's why I ended up going down that path of making my cancer book, my dementia book, my medical reformation book. All of those are full of illustrations because I learned how to draw, and I took my drawings from my lectures and I put them into the books. And so that was what I was doing. And like I said, too, I went through all the internal medicine books. All the internal medicine subspecialty books, they're basically a joke. They just pretend that, all disease is due to aging and maybe an infection, socioeconomic, part genetic. It's all BS. There's obvious causes of most of these diseases. And once you start learning them, you have a much better chance at a good outcome. So anyways, that concludes the top 50 books in health and nutrition of all time. I hope that was interesting and helpful.